Medical students, if you're looking for a fast way to learn medicine, then put aside those flashcards and put aside those question banks. Check out Scope's interactive case-based platform designed to help you to learn medicine faster. Now, you'll be able to use our interactive platform, which is designed by doctors for future doctors. It's built on real-world case studies. I'm Lorraine Wright and I'm overseeing community here at EMRLD Health. And today I'm going to show you how you can use Scope to master medical concepts quickly and effectively. Now, Scope is designed to transform your learning experience by simulating real-life patient care, helping you to apply your knowledge in a practical setting and allowing you to document and review your progress comprehensively. One way you can use Scope is actually by using our real-world case studies. And this is truly the fastest way to learn medicine by simulating patient care using Scope. Now, this approach is similar to a pilot who's actually using a flight simulator to prepare before flying real planes. Now, here's how you can get started. Now, the first thing to do is to access the case library. So head over to Scope's homepage, and on the left-hand side on the navigation bar, you will see Case Library. Click on Case Library. Here you'll see the course library of all the various cases and courses that Scope has to offer. Now, let's assume, for example, that you were about to start a neurology clerkship, or you were doing a placement, for example, and over the weekend you wanted to practice and prepare yourself for that clerkship or placement. Now, what you can do is actually immerse yourself in the courses covering the common neurology symptoms such as headaches and seizures, for example. Now, if you're uncertain about which symptoms to focus on, then do a quick Google search for the most common symptoms seen by neurologists, and that can actually guide you. But head over to the course library, and we're going to click on headache, for example. Now, what you'll do is you'll click on the cases, and this is the way that you can actually start to engage in the interactive case. So we're going to select headache in a stressed student, and you can now engage in this case from start to finish, right? So there's a question that comes up and it provides you with the vitals. It gives you the information and the background behind this case, and it asks you a question, right? So as you proceed, pay attention to each detail from the patient history to the diagnosis and the treatment. Now, this immersive experience helps you to fill your knowledge gap and reinforces your knowledge, right? Now, the active learning part of this is key, right? Because you can engage in the material by taking notes, asking questions, discuss it with your peers. And this interactive format really ensures that you're not learning passively by just consuming information, but you're actually allowing yourself to learn actively by participating in the learning process. Now, another way in which you can use Scope is by using it with real patients. Now, picture this. You've started your clerkship or you started your placement. It's Monday morning. It's time to put your knowledge into practice with real patients, right? And you can do that with Scope Practice. And here's how you can seamlessly integrate Scope into your clinical workflow. Now, here's how you do that. You head over to Scope Practice. On the left-hand menu bar, click on Scope Practice, and here you'll be presented with a screen that allows you to actually diagnose the patient that's in front of you. So navigate over to the differential diagnosis section, and here you'll see the groupings or the various chief complaint options that there are available. Now, we're going to select headache. Now, for example, if your patient has frequent headaches, Scope can help you to differentiate whether or not it's an acute or chronic condition, for example. So you can select the appropriate category and further narrow down your differential diagnosis. So remember to include all possible diagnoses to cover all bases, right? So for example, we're going to select frequent headaches. Now, Scope aids in guiding your examination. So for instance, if you select migraine, Scope will prompt you to record symptoms and also signs as well. So we can select, for example, we can select frequent headaches, we can select nausea, we're going to select vomiting as well. And maybe you suspect that there is dehydration, right? So you can actually now compare the differential diagnosis that there are as well. Now, Scope guides you through relevant physical examination steps. So once you've narrowed down your differential diagnosis, you can actually simulate ordering necessary tests and treatment. Now, this practice prepares you for making real-time decisions in a clinical setting. For example, you might want to simulate ordering a CT scan for a patient with severe headache to rule out any serious conditions like a brain tumor or hemorrhage, for example. So you can click on that. You might also want to select which treatment that you want to actually provide the patient as well. So you can select ibuprofen, for example. So it actually gives you the ability to actually select tests as well as treatment. Now, another way in which you can use Scope is to prepare your patient encounter notes. So, after you've completed a case, you click on Complete and Review. Now, these notes should include things like your patient history, your examination finding, your differential diagnoses, your test ordered, your treatment plans. Now, this comprehensive documentation really helps you to identify and fill in any knowledge gaps. You can then present these notes to your preceptor or your mentor. So, this exercise is not only just there to help you to articulate your clinical reasoning, but also provides you with an opportunity for feedback and learning. Now, your preceptor can also highlight areas for improvement and also offer additional insights as well. Now, another way in which you can use Scope is to actually create and share your own case studies with your peers and the wider community that use Scope. So, for example, when you finish working with your patient and you've diagnosed your patient and you have your patient encounter notes, you can actually then anonymize that and create a new case study on your own Scope channel. Now, this step actually transforms your learning experience into a teaching tool in itself. So you head over to the homepage of Scope, head over to My Channel. So once you click on this, you get to see your channel. You can also customize it how you want as well. But to create a new case study, you simply click on Create New Case Study here. Now, once you've done that, you click on Start with a New Patient, and you can start to actually create questions around the background of the patient, the case, the various information that you picked up through your own encounter with your patient, and then actually ask people to answer the question as well. Now, sharing these case studies with your peers actually helps you to build a repository of knowledge and facilitate collaborative learning. You can also encourage your peers to review and discuss these cases as well, which actually then further enhances your understanding and also your attention. Scope is built on a cyclical process of learning, practicing, and teaching to ensure a deep and lasting understanding of medical concepts. Now, Scope allows you to simulate patient care, practice with real patients, present your notes, and even create your own case studies. Now, all of these are essential steps to help you to master medical concepts fast. Now, this active learning approach ensures better attention and also allows you to prepare thoroughly for exams and clinical practice. Now, while it might seem like it's a lot of work, the benefits far outweigh the efforts compared to passive learning methods such as flashcards, textbooks, and even question banks. Now, get started with Scope today and learn medicine fast by checking out scope-learn.emeralds.health.